So that's because it has a lot of elastic fiber, and that's because it has to withstand much more pressure than the vein. So that's the interna or intima, doesn't matter what you call it. What's this area in here? It's usually filled with blood. The what? Yeah. So it may or may not be filled with blood, depending on when they got it. So that's the lumen. So what is the next layer? The what? Yeah, and it's huge, right? Compared to the other ones. And you'll see something like this. And that, of course, is the tunica media. It's a smooth muscle. And what about the last one? And the tunica externa is not as big in the, it's kind of just like this, right? You kind of see some areas where it's shaded, some areas where it's just kind of distinct, not as distinct. And that, of course, is the tunica externa on the artery. Okay, any questions? Okay, let's go to the vein. What's the difference between a vein and an artery?
The artery is rounded.
Say it one more time.
Veins are squished.
Well, the veins have thinner walls, so they're more flimsy. Because they don't have to withstand as much pressure. Remember that the highest pressure is the arteries have to withstand that. Okay. I didn't mean to write this so distinct. You understand that you're never going to find a solid line like that. That's going to be distinct. Okay. So now let's look at the vein, and it collapses. When they make a section, it will collapse because the walls are flimsy. And actually, it doesn't make these curlicues. So what you sometimes see is just these little black specks. Right? That's the tunica intima. It's not like that solid line, or not like this. So the lumen is larger, because the walls are flimsy, so when they do this, it just collapses. What's the next layer? And the media is pretty small. You know? The walls are a lot flimsier here. The largest tunic is what? The tunica what? Externa. A lot of times it kind of looks like just broken up tissue, but it's larger. And so you would label all the same tunics. Externa, media, you can finish the rest. And interna or intima, and of course that's the lumen. Okay, so this was done at 100x, and this is a vein. These are your titles. This was done at 100x, and this is the artery. And this had to have been done at 400x in order to see anything, and it's a blood smear. You can just put blood, but it's actually a blood smear. Okay, any questions? So are these going to be on the practical?
Yes.
I'm going to start lecturing at 4, so I have 10 minutes to go through the structures that I did not put on when you went around. So it was the brain arteries, right, and the brain sinuses. Again, your land